Hello, beautiful souls, and welcome to Spiritual Chat Live. This is a special edition of Spiritual Chat Live as it's Lyme Awareness Month. Today, my guest is Dr. Armin Schwarzbach. He is the founder of Armin Labs. He has, I feel, the best labs in the world, and we're going to tell you why. We're also going to be talking about a variety of topics today. We're going to be talking about his testing, Lyme and COVID. We're going to be discussing why we feel those are sister viruses. We're also going to be talking about parasites and bioweapons. And we're going to be talking about a lot of things because Armin has a military background as well. And he's also a survivor of Lyme disease. So welcome, Armin.
Hello to everybody. Thank you very much for such a warm welcome again. And I hope for a very effective discussion. Thank you very much.
We always have an effective discussion. We've known each other since we met back in 2017 at the Lyme conference that Sue had. What was her? I can't remember. Isn't that awful? I can't remember her last name. It escapes me right now. But you were there, and Dr. Judy Mikovich was there, and there was a lot of people that were there. I met a lot of people at that conference.
I think it was Sue Fogan's conference that time, or in Florida. So there were a lot of actions that time, also with the retroviruses from Professor Mikowitz, and a lot of struggle about that, as all of us know. Controversials, but in the end, it's always good to have controversials and to discuss something.
Oh yeah, 100%. Yeah, I learned a lot at that conference. I liked that you had your big microscopes there where you were looking at everyone's blood, and you had a lot of great information. I learned a lot, and she had a great variety of things there for everybody to learn from, and spiritual stuff as well as just learning about Lyme and all the different things. So it was a really great conference. So that's where we met. And so I reached out. You were the very first person that I reached out to back in 2018 when I started doing all my interviews and stuff. And I was so excited when you said yes. And every time I ask you to do an interview, I get excited when you say yes, because we always talk about so many fascinating things. And so that's why I was excited to talk to you today, because last year when Sophie Ward and I interviewed you for our podcast, I know you had wanted to talk about long COVID and stuff, and you've even got some testing and stuff in your labs with that. So, and we didn't get a chance to talk about that last year, but I do want to talk about all of that today. So before we get into that, why don't we just give everybody a little bit of your background, and you can tell us about your labs and all of that.
I'm now, we name it in Germany, baby boomer. So we are getting retired, so 60 plus the generation. Yes, we have problems with qualified people to find them here in Germany. I think it's a worldwide problem. Nevertheless, I don't know what's our generation. It's not the Z generation. It's not the W generation. I don't know what we are for generation that time. But in the end, it's a long, hard work life. We build up laboratories from zero, from nothing. So I never knew anything about Lyme disease until I had a patient in 2003 or so with multiple sclerosis. And I was a trained medical doctor, internal medicine doctor with a qualification, also in laboratory medicine. And at that time I said, you cannot cure, it's impossible to cure multiple sclerosis. And by the way, this patient was diagnosed with Lyme disease by a special test I did on her. It was named the ELISpot test. It was not the antibody test because I believed in the antibodies. So I learned, I was teaching in the 80s during my university study in medicine. I was teach if you don't have antibodies, you don't have Lyme disease. So very easy rule and very easy to understand nowadays. I would say it's completely different because we could talk later about our complexity of the immune system and how we react on different pathogens. So this patient was cured. I did this ELISpot. It was positive, no antibodies, nothing in the spinal fluid. They did a spinal tap on her. And that patient in the end was cured with, I think it was 4 weeks ceftriaxone, which is rocephinate. And the patient was cured after 3 or 4 years bad suffering from multiple sclerosis, 40 years old patient. And so I was surprised or shocked. I said, oh, we have a system failure here and we need to do something. And if you know my character, my person, so I gave up a very good laboratory position that time. And I said, now I need to care about Lyme disease and correlation with multiple sclerosis. And I found a lot of patients. We had chances to help them to diagnose, to cure. So what is now multiple sclerosis? What is fibromyalgia? What is about rheumatoid arthritis? What is juvenile arthritis? What is Parkinsonism? So all of these questions came up that time, and then I did more and more tests. And surprise, surprise, I found a lot of Lyme disease patients in the world. And then we had now different options to help them, maybe to cure them. The patient is still healthy. So I cured a patient now for over 20 years now. The time is running very fast. And by my qualification, I did a lot of internal medicine. I was infectious diseases doctor in a hospital. When I was a younger assistant, I was also cardiologist, nephrologist, gastroenterologist, oncologist. I also did chemotherapies with a lot of patients, do this grading and staging with the patients. So long history. And then I decided, I mean, go to laboratory medicine, which is yeah, a very strange chapter for a lot of medical doctors because they don't know how it works, how to interpret laboratory test results. And this is now my mission also to educate and to understand laboratory test. If you have a patient sitting in front of you, that the laboratory test selection is important. To spare the money for the test is important for sure nowadays. And also to say after getting the results back. So how to interpret these results. It's not so easy. I think we talk a little about today about that. And one thing to say, what you mentioned is very, very important. The spiritual level in all of us, let me say so. The Roman phrase mens sana in corpore sano, which is a Latin expression, it means a healthy mind in a healthy body, or you could also say a healthy body and a healthy mind. So I think it belongs absolutely together. The spiritual level, the healthy mind in a healthy body. And if you don't have a healthy mind, you cannot get cured so pretty well. If you have a sick body, you have also mental issues, neurocognitive, long-term memory loss, or whatever Lyme patients suffering from. So, and this is a chapter, Panic Attacks, which was opened by Bob Bransfield last week. We had a European conference in Lisboa from IELTS, Lisbon. And there he also clearly taught us that it's so important to check patients with Lyme disease, also if they have panic attacks or anxiety problems or depression or aggressiveness or whatever they're suffering. So mens sana in corpore sano, I think this is a phrase, but it's absolutely correct.
Oh, 100%. There's with Lyme disease, I mean, I, I want to go back just a little bit where you were talking about how the MS patient you cured. I want to use that word cured because I think a lot of people get in the mindset of where it's not possible to be cured, especially someone like myself. I was misdiagnosed for 16 years. So it just takes a while to rebuild your body. You know, you've got to treat and you got to treat aggressively and get pushed through all of that and then get your body in a state of wellness and maintain that wellness, but continue to rebuild. You got to, your body's been sick for a long time. So you got to build, 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 and maintain. So, like, here's my, I'm going to tell you a hypothesis I have, Dr. Armin. I want to, because they say Lyme, you know, is the great imitator, it mimics all diseases. Would you, would you venture to say, and this is my hypothesis, that all diseases, all disease labels really is Lyme disease?
No, that's absolutely incorrect. So not everything is Lyme disease. You cannot put every patient under the roof of Lyme disease because symptoms you're suffering if you have chronic fatigue. This is not specific for Lyme disease. If you have a joint arthritis, it's not specific symptom for Lyme disease. A lot of patients had tick bites, so you cannot say I have now antibody, IgG antibody, and now I have Lyme disease. So that's completely nonsense. What we need to differentiate in every patient is a individual um, profile of different bugs. So the five big bug groups are in the world the bacteria. It's the first group. The virus group is the second one. The parasite group is the third one. The yeast group is the fourth one. And the mold group is the fifth one. So, and all there are a lot of these different pathogens, bugs in all of these different groups. We need to differentiate. Not everybody has Lyme disease. Not everybody has a co-infection with a Bartonella or, but what I can tell you nowadays, everybody we see with symptoms and sick patients, also with multiple sclerosis, they have multiple infections. It's not just one. They have a lot of viruses reactivated, also the post-COVID or long COVID group. This is the way we need to go. And then we have options to treat and maybe to cure. We cannot rescue the whole world, but we can improve, we can stop infections, we can for surely also cure some of these patients.
Well, when you were breaking it down into the groups, when you were saying, mold and viruses and bacteria, those are parasites. So if you look at parasites, you break them down, they're bacteria, viral, fungal, mold, and then actual protozoans. So when I was with this is how my brain works. When I was thinking about like how Lyme could be all diseases, because Lyme is a bioweapon. And when it's a bioweapon, it was created a long time ago. Like Julie Millay, she's written a book about it. There's been other people do research on this too, with by the Russians. Then if it's bioweapon and it mutates, right? Because if it's bacteria or viruses, if it's these different pathogens, it can mutate into different things and cause all these different things in our body. Because Lyme, like for me, I had Lyme attack my thyroid. They wanted to take my thyroid out. And I was like, no, I don't want to do that. Then it caused seizures. I had a stroke. So it's attacking your brain. It's attacking all these different things, but it is all these different pathogens at the same time. It's a very smart, intelligent thing. This is why I love your labs, because you're very intelligent, Dr. Armin. You have like figured out, your labs have been able to figure out like how to diagnose someone who can't get diagnosed somewhere else. And then, you know, you've got to have you have to either do you have people in your labs that help people? Because I had to learn how to read my own labs, because no doctors here, no one could read my CDC positive test results. I had a Lyme doctor that could, but a normal doctor, primary care physician or a neurologist, they had no idea what they were looking at. So do you have people, if they come to your labs, do you have people that are able to help them read their labs?
Yeah, I want to go back a little to the
I know,
bioweapon
jump around.
discussion with you. That's very important. No, if you look at the cinema film Napoleon,
Yeah.
it's in the film. Napoleon's army was stopped. I think it was shortly before St. Petersburg in 800 and 1812, because louse-borne diseases such as typhus and trench fever killed one third of his army. Okay, so the bioweapon could be a tick, could be a lice, a louse, so could be an animal, could be something which a mosquito bite, which transmitting something bad, or a SARS-CoV-2 virus. If you have a lot of cough, you could stop completely the armies. So when I was a military soldier in 1981 until 1982 until 1984, we were together with American soldiers that time at we named it the Iron Fence. It was this Cold War. And I was vaccinated, interestingly, that time against smallpox. 1983, although I was vaccinated against smallpox years ago, because smallpox was an issue for us, a life-threatening infection. Why? Because in military we have atomic weapons, we have biological weapons, and we have chemical weapons, ABC. So maybe you heard about that. If you go into news, and this military, but it exists for sure. So, what about the biological weapons and the smallpox? They said, oh, now smallpox could be killing all of our German soldiers. Who was yeah, let me say, the enemy on the other side. Um, they producing smallpox. Why they manipulate these viruses, and therefore we all got vaccinated. Now I could officialize that, but I was not aware that time that there are a lot of also tick bites could be a bioweapon or Borrelia transmitted from the tick bites. Also mycoplasma, Gulf War One syndrome with Garth Nicholson, Professor Garth Nicholson. If you talk with him, he would confirm that to you that so during the first Gulf War, the biological weapon, okay, we cannot, to prove something, SARS-CoV-2, was it now a biological weapon? But it looks like, if it could kill armies, if it could kill people, it could kill armies, it could change the whole political structure in the world. And for sure, you could manipulate all of them. That's pretty sure that you could manipulate in biological army laboratories. You could manipulate viruses. You could manipulate bacteria for sure. Parasites, I don't know exactly, but you could manipulate. You could exchange DNA structures. This is a very old known story. There's nothing new. So we could discuss that, and we could do, to say, some say that SARS-CoV-2 was also a biological weapon because it looks like it killed a lot of people. It could kill soldiers. It could kill whole countries, to eradicate them if you don't stop the mutations. And yeah, and this was the point to say to that. In the laboratory work, we don't want to do these kind of diagnostics. I know there are military labs which are doing that, and as Garth Nicholson was a scientist in that with Gulf War One syndrome, I think it was 1992 or something like that, or 1991, where he found out that mycoplasma was genetically manipulated. And this transmission, how could it happen? It could be a lice or a tick bite or whatever, but the pathogen is still in that also, and the pathogen is stopping you. It's the invader coming into your body. So it's not an alien coming into your body, but it's a bug coming into your body, and also this depends on your immune system. To be honest, if you have a good immune system, you have more power to do something against it, because Napoleon's army was so weak because they were all thirsty, they were hungry, they didn't have any good immune system that time. So also in this cinema film, you will see all of that explanations for that. But in laboratory work, Armin Labs, we are doing these tests for a lot of patients with multiple sclerosis, and for sure we cannot find in all of them, but Lyme disease or chlamydia or EBV, Epstein-Barr virus, also now, I think in 67% of multiple sclerosis patients, it's proven now that reactivated or chronic Epstein-Barr virus infection is doing multiple sclerosis symptoms. But some have the luck maybe to suffer from Lyme disease, and then you could use antibiotics or other herbs or whatever good remedies, strengthen the immune system, and then you have a chance to cure them, to help them, to stop them. What is the alternative? The pharmacies are just using what is it named? These cytokine blockers. They block the TNF alpha receptors, they block the cytokines or the interferon gamma, they block it, or they suppress and destroy your immune system. And this is not the way we want to do. We want to build up the immune system and to fight against the bugs. And this is now my 3I model I bring to all of you, which is so important in the world now. We need to treat the infection, which is reactivated or chronic persistent, we name it. Maybe it's Lyme disease, maybe it's a combination with chlamydia, Bartonella, whatever, rickettsia, a virus infection. We need to treat this for sure. And we need also to know what to treat, which infection, that's important. But we need also to diagnose and treat the second I, which is the immune system. I already mentioned that. And the third big I is pretty clear, is the inflammation. because, all of these patients have inflammation in the skin, in the vessels, autoimmune diseases, Hashimoto's, whatever, cancer patient. It's now more the turbo cancer coming from spike protein. We see that also because my wife is a biological cancer expert. She's doing dark field and all of this, and we see directly correlations with a bad immune system, with the erythrocytes, with chlamydia, with Borrelia, with viruses, with parasites, with yeast and mold. But it's different from patient to patient. You cannot say one size fits all. One patient is having the same infection. One patient needs the same therapy. This is impossible to think that way.
Oh, 100%. That's what I've it's not a cookie cutter protocol. Everybody needs their own personalized protocol. And that I will say years ago when I was studying stuff, I did I think it was Dr. Stephen Bunner. I read in one of his books that you had to boost the immune system naturally. And he recommended 6 to 10,000 milligrams a day of vitamin C, but natural vitamin C. So, like when you're taking a synthetic form of anything, your body's not going to recognize the synthetic form. So you have like it's you could take all the synthetic vitamin C you wanted to because you're not going to OD on vitamin C, but it's not going to help your body. So your immune system's going to keep being suppressed. So you got to boost and like I take camu powder. Like organic camo powder for vitamin C, and it's got all kinds of antioxidants and all kinds of stuff in it for boosting my immune system. But I also eat like a really healthy organic diet as well. But when you're sick and you're on treatment, it's really hard to eat when you feel sick and all of that, and you're trying to, and the medicines make you sick and all of that. So, but boosting the immune system is key and reducing the inflammation because your body, the Epstein Barr, I was it you or was it Dr. Ingalls? One of you guys said that the Lyme, when it will reactivate the Epstein Barr and the Lyme will give you false positive Epstein Barr results. Was that you or was that Dr. Ingalls?
Yeah, it was me together with Ingels. We did started with some products we use in viruses as it is Totunia and Takuna as an example. It can cross-react in a polyclonal stimulation. So the symptoms are the same, but what is triggering what is reactivating what? Maybe Epstein-Barr virus is reactivating Borrelia. This is the hen and egg question. So we cannot answer that absolutely. But in the end, they belong together. And if you have the infection with a virus, what is named Epstein-Barr virus, but now also we forgot about the cytomegalovirus, CMV it's named. It's not so very well known in the world, doing the same symptoms, doing also non-Hodgkin lymphoma and all of this stuff, fatigue and leaky gut. But in the end, you see that the symptoms, again, are not specific for Lyme disease, are not specific for Epstein-Barr virus. We need to differentiate, and therefore we are doing the tests. I can tell you exactly which virus, which pathogen, which bacteria, maybe Borrelia, maybe Bartonella is active in your body or not. And then you have an individual profile. We are profilers in the laboratory. Now we are like in a criminal story, who was the murderer? We don't know exactly who used the weapon. So we have some points we point out by symptoms of the patient because not all of these infections doing the same symptoms. There is a little differences within that. As an example, this Epstein-Barr virus is a lymphotropic virus, so very often lymphatic system, lymph nodes are swollen, liver has a big detox problem, spleen is swollen, it's gut infection also. They are lymphotropic and they also are cardiotropic, so they irritate your heart rhythm, inflame your heart. Or infect your heart, inflammation, infection, and they also tropic to your brain. So you have also this massive problem with concentration, memory loss, and so. And you think it's Lyme disease, but the treatment for virus is different. We need to be careful to put every patient under the roof of Lyme disease. So it's very easy to do that. In the beginning, I did the same, and then Judy Mikloshi came to me from Canada. She said, Armin, I think it's 15 years ago, and not everything is Lyme disease and multiple sclerosis. sclerosis. I said, what? She's from Canada. And it was chlamydia pneumonia. She did a lot of research and mycoplasma. She said, I mean, this is chlamydia. And I checked for chlamydia, which is aerogen transmitted pathogen. Also in long COVID, it's very, very popular to spit out the biofilm, spit out the slime, have cough, This is the problem of the reactivation. We carry a lot of these in us. And if our immune system is getting a vaccination or a stressing factor or surgery or whatever, then it's reactivated. And then we have the problem. And then we are tired, we have sick, we have joint arthritis. These pathogens all doing mitochondriopathies. All of the patients are tired. There's not one patient without any of these virus or bacteria or parasite. They are all tired. They suck our energy. They do the inflammation. This is a general principle. So to say, I know of chronic fatigue, it's Epstein-Barr virus. That's not correct. We need to test, we need to know what is active, which pathogen, which bacteria, which virus, again, parasite is active in which patient or together, and then we can treat, individualize, and that makes sense.
So I know I've had people ask me like that I've sent them to your website to get, and they get overwhelmed with all of the tests that you offer. So if someone is suspecting that they have Lyme disease, or maybe they don't know what they have because they've had doctors give them, oh, you have Epstein-Barr. Oh, I think you may have fibromyalgia. Oh, you may have lupus, or you may have MS. What if they're coming to your website? I know you have like a free, like a sheet that you can check off your symptoms or whatever. But people a lot of times are still confused because they've been probably to like 10 doctors by that time. What would you suggest for them to do with all of the testing that you have on there?
Meanwhile, we developed panel tests, because we wanted to go evidence-based, and all of our panels are evidence-based medicine. So we have studies behind that Epstein-Barr virus is doing multiple sclerosis, or herpes simplex virus, herpes on the lips, is doing Parkinson's, or Coxsackie virus, which is not so pretty well known now, but it's coming a little in America and in the world. Coxsackie is a gut virus, which is doing leaky gut, histamine intolerances, all of that. And fatigue. And this Coxsackie virus, 70% is doing juvenile diabetes. We have a huge multi-center study about that, So it's a virus you get during childhood, you get infected in the gut, you have the hand, foot, mouth disease, you have the herb angina in blisters in the mouth, and this is coming and going over these, and then you develop juvenile diabetes. And this is because the virus destroys the pancreatic B cells. This is proven now. What does it mean? To diagnose very early and to try to stop this infection, inflammation, and to improve the immune system that time. But the pediatrics who deals with juvenile diabetes, what they are doing nothing in the infections nowadays. So we need to educate, we need to bring it around the world, these papers. And we did profiles now because it's easier than this mentioned checklist individual. We can do both checklists if you want, but I think we are profilers. Therefore, we develop the evidence-based profiles of tests.
Okay. Do you also check for like vitamin and mineral deficiencies in your labs?
Yes, we check also for vitamin B1, K2, D3. That's very popular, B1, B6, folic acid, the most common ones. We do that. But I may ask you the question. If you have a bad gut, you have a leaky gut, how do you want to bring the vitamin D into your body? I think in many of the patients, they tried the liposomal or whatever, but we have a resorption problem, our gut is inflamed. And these bugs, cytomegalovirus, Epstein-Barr virus, Coxsackie virus, Echovirus, Yersinia, Campylobacter, the gut pathogens, they are all living in the gut, and you cannot resorb it simply. You cannot bring it into your body. This is a huge problem. I studied pharmacy, by the way, also 2 years. So the problem is also how to bring vitamin D into your body if you cannot digest it, if you cannot resorb it. It's really a problem. So you use more, but what is the message? Treat the gut. And to be honest, the nutrition is the key role for all of that. We have so bad nutrition in the world. When I went to Portugal, it was horrible. I went to Austin before to the TFIM, it was horrible food. So we need nutritional advice to boost your natural self-healing powers for detox and de-acidification. And 80% of the immune system is in the gut. That's proven. You treat the microbiome, but you need also to you could use the what is it named, this microbiome treatment, this help me this what you do, the pills, these capsules, the lactobacillus, and so you could do that, the probiotics, sorry, that's the name, and the prebiotics, you could do that. But still, if your gut has an infection inside, in the endothelial cells of the gut, you will not be successful, but a cheaper way to start with it would be to change your nutrition. And I could give you a lot of advice because my own case, I tell you that I'm not eating any gluten or wheat or potatoes or chestnuts, as an example. So what I eat is, as an example, buckwheat, quinoa, amaranth, no rice, so no meat, in any way, no sugar, no alcoholics, So these are guidelines. And if you follow them, you lose your weight, you get a better immune system. 80% is an immune system, but still it's enough to cure your gut, to repair it. Because if there's an infection, you need to treat the infection. And we have, you mentioned Stephen Pune, we have powerful herbal remedies and these herbs to treat gut infections with it.
Yeah. His book, I actually got to speak with him. I messaged him on Facebook years ago because
Um,
he talked about ghost pipe tincture for like the bone pain because I had nothing would help that bone pain. I couldn't find it. I actually found it last year, which I just use it for migraines and stuff now when I get them sporadically. But he messaged me back and I spoke with him briefly because I had some questions, and I think this was back in 2000 when was this? I don't know. It was either 2016, 17, I want to say, because I was reading all of his books and trying to, design my protocol. He was a very nice man. He was a very nice man. So, but yeah,
yeah.
his books, a wealth of information. But
I just could recommend buy the books, his books,
yeah,
the herbal antivirals, herbal antibiotics treatment. Not all herbs are in it. He stopped at a point. Tacuna is not in it, but Totunia is in it, as an example, or cat's claw. You find the common one also in other books. But he did the fantastic summary with evidence-based literature behind that. I think that's the only teaching book we could use in, or books we could use in the world. He's not still among us, but he left this for us, and he was really a great person. I never met him, so congratulations that you met him. Yeah.
it's brief, but it was cool. His Huchinia, that and the Japanese knotweed, those
Mhm.
two effective, like I use them together, those were very effective. And then the other thing that I found really effective, which I learned from a Dr. Cass Ingram, was the oregano oil. That really hit the Bartonella, because I had two strains of Bart. It That really knocked it. So
Yeah.
it's the thing that I wanted to move on to next is Lyme and COVID, because I know a lot of people are struggling with COVID, and I actually had it back in early 2020. And what I noticed with COVID, because I was in a wellness state from Lyme then, and it knocked me out of wellness because I was only 14
Mm.
months in wellness from Lyme. So my immune system wasn't strong enough. Which you talk about the immune system, your immune system's got to be strong enough to be able to, it'll reactivate. Um, I noticed COVID cycled like Lyme. And I noticed this after about, I don't know, it was several months. I caught it in February, March of 2020. And then it was around July. I was like, this stuff's cycling. It was cycling every 5 to 6 weeks. And Lyme for me would cycle every 3 to 4 weeks. And I thought, what is going on with this? And it cycled for 18 months, Armin, 18 months. And then I was like, well, I'm going to have to treat this like Lyme. So I went back on treatment like I did for Lyme, but I was effectively like going for the COVID stuff, but I was, and I had to go a little bit differently, but I went harder than I did with the Lyme. I told people I was treating for Lyme, so here's the cat's out of the bag now. I was really going for like the COVID stuff, but like, yeah, but I finally got it back under control last October. But it's been harder this time. And I've still been fighting like the fatigue and all of that, but it's getting better. But I want to talk about that because it seems like they're sister viruses, the Lyme and
Yeah, this may. But you mentioned this 18 month. I have a scientific paper about that, the
oh,
circulation of the spike protein, post-COVID, long COVID. But it was an early paper from 2022 or so. But we know it can circulate from the beginning, this spike. Where is it circulating? It's in the pages and the monocytes, and this is where the living virus could be, but it's more the rest of this virus. If a virus dies, there are rest of the protein. It's N protein, it's a spike S protein, and these are circulating in your body. And the macrophages, monocytes, they can transport it everywhere. And what happens if it's circulating? Then it's moving into your brain or your joints or your heart or your lung, and then you have the problem, or sinuses, then you have still the cough. All of these are expressed in the mucosa. So you will see that a lot of these patients have reactivating sore throat or teeth problems, or also spitting out biofilms, But in the end, this also means that other pathogens or bugs are reactivated, as it is with chlamydia mycoplasma. When I have a patient spitting out slime, I had a patient from London, by the way, on Monday in my laboratory, and he said he had 6 times COVID-19, not vaccinated, 6 times the infection. And he suffered still from spitting out slime, biofilm. And I said to him, you have chlamydia and mycoplasma pneumonia reactivated for sure. And I found this, That means now we could treat it. We treat the biofilms, which is pretty sure we need to do that. And then the patient has a chance to get better because this is doing the spike protein, is doing inflammation, immune suppression. And what we know nowadays, to be honest, we have the special test for that, for the spike protein. The spike protein is circulating, I think, now from the beginning, in not all patients, some patients, but especially in patients with a vaccination, they are so over boosted on the mucosa with the IgA antibodies and the interferon gamma release in our eye spot. We see the spike protein reaction. It's horrible. It looks like they have permanently the infection in the body, but it's not the infection. They are not infectious, but they cannot infect each other. Maybe they could be spreaders or whatever, or give the spike protein to others. But in the end, they all have reactivated viruses and reactivated other Lyme disease, as you mentioned. This is a typical story. You're not the only one. We have hundreds, thousands of them, all asking for tests, and we find every time the same. Very high spike protein IgA, very, very high, which is we cannot measure it. It looks like the vaccination was yesterday. It's looking like the infection was yesterday, but they had it months, years ago. You understand this over boosted situation. We name it the Th2 system, which in the end you get the autoimmune cascade and autoimmune problems. And on the Th1 system, this is the cellular system, we find so many with interferon gamma release against spike protein in our tests. And this is also horrible because if you have interferon gamma, you have pain, you have still ongoing infection. And by this process, the immune system is completely damaged. And then you get this reactivation of a lot of other bugs in the body. And still your immune system is going down, and inflammation is a horrible situation. And we agree also with CDC in America with their sentences about that. But we know now that the spike protein plays a problem in the circulation in macrophages, monocytes for years. And we know now that it reactivates by the immune suppression and inflammation. It reactivates especially the viruses, as it is Epstein-Barr virus, EBV, cytomegalovirus, herpes simplex virus on the lips, the chickenpox, varicella zoster virus, HHV6, which is human herpes virus 6, 7, 8, the Coxsackie, and the echo. These are the main common ones. We diagnose in nearly every patient with chronic fatigue nowadays, and problems you already mentioned with maybe your fatigue after this episode in your life.
so is the is fully healing from the proteins and to prevent the activations, is that keeping the inflammation down and the immune system fully boosted so that those things don't reactivate?
Still, yeah, it looks like you permanently got a shot into your brain. It's still boosting, yeah. And why should you get? This was a question, or point I never understood during this vaccination of the different waves. Okay, the shift and the drift, you understood that of this virus, but in the end, the patients who got vaccinated, they were more sick than other ones, not so with not so many vaccinations, because vaccination they are over boosted. Nobody controlled the titers. Nobody did it. Nobody checked the immune system. So many patients running around with a very bad immune system, stressed patients, managers, whatever, no money in the pockets. These patients are extremely stressed and the immune system is so down. And then you vaccinate. You know what happens? Boom, explosion, immune suppression, more reactivation of herpes simplex on the lips is a typical example. You all know of that. Herpes zoster, it hurts. It could be reactive. You all know, but we see now a tremendous number of these very, very immune suppressed patients after having these SARS-CoV-2 infections plus vaccinations. I think these double effects boosted extremely the immune system, as they look like patients or people still ongoing vaccination every day in their body.
Oh, 100%. Oh, yeah. That's what I mean. They're all coming out now and saying with the whole, the vaccine and all of that is it's destroyed the immune system. The spike proteins and all of that. Eh, There's too much evidence. So, um,
Um,
and
maybe
I
maybe
have more to
mention.
say on that, but I know like when we're going to put this on YouTube, I know we'll
Yeah.
get we're going to get
No,
dumped.
we want no, no, no. This is I'm realistic. On the one side, you needed to protect people from to get killed by a very strong virus. On the other side, nobody checked the immune system, and this is the wound or the point I didn't understand myself. For we didn't check the blood for vaccination titers. We had them for IgG. We could have done that and then do the next shot. To think about how strong is the immune reaction now, and what is not available or was not available long-term data. You could say this is still in clinical experiments. You would say this is phase 3, but I know the political pressure was there because people killed, and that was horrible. Also, people I know, we needed to vaccinate to do something, but not with the immune incompetent. Why? And we didn't check the titers. Why didn't we check the titers? We do for every infection, we could do a titer, an IgG antibody titer. It's so easy to do that. Hepatitis B, C, influenza, we could check the titers. If how high is your titer, and if you're overdone with the titer, why should we bring the titers to extremely versions which don't protect against this mutation? This is from immunology's standpoint, it doesn't make really sense in medicine.
Yeah, I agree with you. It makes perfect sense.
Yep.
100%. So, what about what else do we want to talk about, Armin? We What about with the biofilm? So, like, all parasites, is this true? Do all parasites have biofilm? Because you have to bust the biofilm. And what about the persister cells? You got to eradicate the persister cells because if you don't do those two things, you'll never get well, correct?
This is absolutely good question. You are a genius asking that question. Yeah, I ask myself that question
Yes.
very often. Yeah, to mention also Borrelia is doing biofilm, chlamydia, also bacteria, not just the parasites. Also viruses doing biofilms. Also gut bacteria doing biofilms. A lot of biofilms produced also in our lung. If you have a cough and a cold, the biofilm spitting out it, you need to bring it out. So you need to treat the biofilm. Now, they are trying to do tests for the biofilm. It's not available in good laboratories, in accredited laboratories as we are, but it will come. And the other point is also how can we deal with that whole situation? And the second point I forget now. What was the second point? Sorry, the biofilm. I'm now in my brain with the biofilm. What was the second?
Persister cells and
Ah,
like,
persister, yeah, persister, exactly. Yeah, I want to say, yeah, this is a different chapter. Biofilms are protection, biofilms communication, maybe to say that again. Also to chat with each other, how to replicate, how to protect. So a bacteria living in your body, which is could be a good bacteria or bad bacteria, or good virus or bad virus. We live in a community with them. We need to range. We are full of bugs. The dogs are full of parasites, and we keep them under control. We could use some chemical drugs. Tafenoquine is now highly discussed in Babesia as an example. We could use hydroxychloroquine, antiparasitals. But the question is if the pathogens are intelligent. They didn't want to get killed or destroyed. The SARS-CoV-2 showed us this story. Also, a virus is not interested if you would be a Borrelia burgdorferi, a living one, you would be not interested that an antibiotic would kill you or so. No, you're not in. You want to survive. You want to escape. We name it escape mechanism. So all of these are doing. They're intelligent, and some of them are stupid. You could kill them for sure if they are extracellular, not intracellular. And what they can do, a lot of these, what you already mentioned, persister forms. Lyda Metman, very popular, very famous scientist. I admire her the same as I do with Stephen Puner. She already said this development of chlamydia, pneumonia, and borrelia into persister forms round body. They named it L forms or cyst. Yeah, what does it mean? You cannot reach so easily with an antibiotic. It's not impossible to kill or to destroy. But if your immune system is strong enough, you have a chance to keep these bad bugs under control. And I think we need an arrangement. And now we come to this Roman sentence, a healthy mind in a healthy body. And this plays also for sure a role in this. If you cannot defeat a pathogen by that, you cannot defeat a cancer cell circulating in your bloodstream by a healthy. If the invader is too bad to you, if the invader is too aggressive, it could kill you SARS-CoV-2 within minutes or so. But if the invader is a maybe more or less friendly, more friendly one, you could arrange. You could say, "Oh, you're the third wave Omicron virus. Let us arrange a little with our immune system." Nevertheless, the wave was also bad. I had Omicron that time, so I know what I'm talking about. This Omicron sucked my whole energy by about contrary up to zero. What did I do? I did a lot of immune support, as you mentioned, with a vitamin C in the right way, and to boost my immune system, and then absolutely rest, no stress, no work. And this is the problem. All of the patients, they are extremely stressed and they put themselves under pressure, or they don't have the money, they need to work, they cannot go to work. This is not just for Lyme patients. All of these infections belonging to persister forms, intracellular. So some are simply our friends in the gut. As an example, we have a good microbiome, we have good pathogens as the lactobacillus, but we have very bad if you have some aspergillus in it or mycotoxins from that, it could be very bad for your gut or some yeast, So this could be a problem. The immune system plays a very, very important role, and therefore we do a lot of diagnostic tests for CD3 cells, CD19 cells. CD56 and CD7 natural killer cells. So we check the complete immune system, Th1, Th2, and natural killer cells, and then we know where you are, and we need to work on that. Also, me and you, we need to work on our immune system permanently because all of these mycotoxins, the microplastics outside, the chemtrails, whatever. Our world is or was is or is still dirty, and it's a threat, a life-threatening world. Our food is getting very worse. The aluminum, the heavy metals, all in this complexity. The cell phones. So our world is not a healthy world. Maybe it was not a healthy world before, but we know now more about, and we know about the risks, and we have a chance to avoid these exposures. We have a chance. The more we know about also to do something against biofilms now, and also we use biofilm breakers, you know it better than I, and also maybe we use also against persistiform a longer treatment, you know. So they will still coming out. You could mobilize them with a sepper from Hulda Clark as an example. You could do Herxheimer reactions with it, also other infections like virus is doing. So you could reactivate and then you could hit it. But I think if you hit too strongly these pathogens, also not so good. It's better to strengthen the first line your immune system and not to hit it too hard with virostatics, with valacyclovir or ganciclovir, and not all of this antibiotic bullshit long term. You know, some patients are using that, okay, but they destroy completely the natural immune system, which is 80% their gut, and then the virus is coming, the parasites coming. So what I'm 20 years old IELTS member. I know all of this long-term antibiotic stuff. So nowadays I'm more going healing by nature, healing by a good mental health, you know, and a good family situation. All of that belonging to that.
Oh, I agree with you 100%. Healing naturally, that's how I got myself better. And when you were saying about your vitamin D, I get my vitamin D from the sun. I know I live in Florida, but still, you do have, everybody has summertime. And like, if you can get outside every day, 10 to 20 minutes, when from spring to fall, you store the vitamin D in your system. And so that helps you get through the winter months when the sun's not out so much where you live, where, like in northern climates or northern countries. And for over a year now, I've been using medicinal mushrooms, reishi, like all medicinal mushrooms, they have like I forget how it is, but the vitamin D is in there. So when you go outside, the sun, when it hits your skin, it activates with the mushrooms in your body. So it makes the vitamin D. Like it's really cool how it works. I'm not, my brain's not working well enough today to retain what I read, but I know like the mushrooms are really good for that. So I try to get all my stuff naturally. Now I have been doing a lot of research lately about minerals, and I have been for the last 2 months. I've been incorporating organic sulfur (MSM), and it's been doing wonders. Armin, it has been doing wonders. Like for my energy, my fatigue. Like I've been sleeping like when I was a kid, really deep, good sleep. Now, last night, that's not the case, but it was like it's been doing really well. It's the third most important mineral in your body. So I do think like what you were saying earlier about our food, how our food is so deficient in minerals and vitamins and stuff, and like we got to get back to that. So if you can get back to supplementing with organic, natural forms of stuff, whether you use like the medicinal mushrooms, and they have to be done right. You got to do your research. You have to do your research on all of this because like the medicinal mushrooms, they have to be double extracted in alcohol and water. Otherwise, you don't get all of the benefits from it. The polysaccharides and the all the my brain's not working right today. the and the organic sulfur, like you can't have any of the anti-caking things in it or anything. It's got to be pure. And if it's going to cake in your bottle, who cares? Like it's just like salt in a glass jar or something. Just shake it up. It's fine. The minerals, I think because we're all deficient in everything, we've got to rebuild our bodies back up. So, and I think because I had like a flare going on for the past 3.5 weeks from supplementing with the sulfur. I know for a fact I was deficient in it. So if you rebuild your body up, and it takes time to rebuild, and I think that's part of the problem is people don't have the patience. They don't understand if you've been sick and think about it, you may have been sick your whole life, but nothing happens until you have a crisis where, like you said, with stress brings out a lot of stuff. So when you go through a really traumatic event, maybe it's a car accident or a death, or even like childbirth, things will bring out stuff in your body that have been dormant for a long, long time. And so, or you get bit by a tick, like a lot of us did. So it'll bring stuff out that was in there. It's going to take you a while, years. It's going to take you years to get back to a healthy state. A lot of patience and a lot of time and a lot of becoming your own doctor and researching, because the sad fact is that most of Western medicine doesn't understand how to treat Lyme disease, how what to do with it. They know acute. They know acute. They don't know chronic. And but that's why we're fortunate to have you, because you're the first step. Armin, your lab is the first step in getting diagnosed and getting treated. Um, the and and you're also going to the spiritual part of it, with like knowing you have to have the mind, the body, mind, heart, and soul connection, because it's all of it together to get well. It's not just the physical. You have to have, a healthy mind. You have to have your emotional part healed, your spiritual, everything's got to be together in order to be healed. So, and you can be healed. You can be healed from all of it. Wow.
Yeah, I could just say there's nothing to be added. So we are on the same page, So what we are doing in pharma, I studied pharmacy. The pharmaceutical world is a chemical world, but in the end, it came from the nature. And then it was developed more into the chemistry, and I want to avoid all of these side effects, to be honest. The side effects, every drug you're using has side effects, and you have a higher risk to get the side effect. Then you need the next drug. And what is our main problem in the world is the symptomatic therapies. If you have pain, nobody's asking, could it be Lyme disease? Could it be rickettsia? Could it be a virus infection or reactivation? What is it? Yersinia or whatever. What is it? They all treat the pain with painkillers. So they treat all with cortisone, corticosteroids. They damage your immune system until the end. Yeah, I wanted to say to kill you, but it's not good to destroy immune system. It's much better to support immune system. And the first step again is easy and doesn't, yeah, it costs a little money. If you drive to a farmer's market in Florida, you have wonderful farmers markets, I know, there. So you get healthy food, healthy nutrition. Maybe it costs a little more, but then you have the first step done in the first step of getting cured. The capsules, if you go in America into a drugstore, for sure. But if your nutrition, still your gut is not the best nutrition, these capsules are masquerade of it. You also doing symptomatic therapies. So much better is it to, but I know it's extremely in this fast food and burger and stressed world, extremely difficult, also genetically manipulated food, to find healthy food. You don't have your own gardens. You don't have your own production of salad outside. You don't have tomatoes in your garden. So we should do that. You should get all goats and sheep in your garden. So this is the best milk, or camel milk is the best hypoallergen milk in the world. So you don't get any allergies by that. So, but who has camels in the garden? Who has a goat in the garden? Who has chicken, free running chicken in the garden? We don't look back 50 years. A lot of people had that. It's not just in Europe. So the time has changed to genetically modified, quick production of food, bad food. This really, yeah, let me say, mass production food. Nobody's cooking in the kitchen. So denaturation of vitamins if you don't cook in your kitchen. No good salads, no good vegetables, no good mushrooms. All those logistic chains behind that. If you go to Dubai, there's not any fresh food. You have this yeast and mold problem massively there, because the fruit is contaminated. It's not very fresh. It's not coming from the sheikh's gardens. It's all imported and in plastics, in aluminum boxes or whatever. So yeah, this is not the way we should toxify ourselves. We kill ourselves by that in the end. Also, the microplastics are now strongly discussed. Microplastics in the fish, and where's the fish coming from? Um, it's so difficult. Our food is really complicated now. What to eat, and yeah, still, what is healthy food? And then you could do detox. You could do what I'm doing, colon hydrotherapy, cleaning of my gut as an example. I do rectal ozone. I do for sure vitamin C booster in infusions. You could do a lot for your immune system. That is not a guarantee. I'm an older guy now. I toxified myself with a lot of Bavarian beer, pretzel, what is it, sauerkraut, and a lot of meat and steaks, and my time is over. And chicken and turkey, all of these fibers you have in your gut, and you cannot digest, simply not digest. So go back to a better nutrition. That would be the first step to me. But in the end, you need also support from nature, a chamomile tea as an example, or a cistus plant tea, or artemisia tea, whatever you use. These are herbs and they are helpful for your gut. And if you have a patient, as an example, with a gastritis, we have this bleeding tree with this Sangre de Drago, its name. So it's really, really helpful. This herbal plant, it looks like dragon blood, and you could get it, you could buy it. It's easily to do, and then it's much better if you have a gastritis, as an example, than to use any pills. But these people are also stressed, we know that. So we need, or they are smokers. So we need to avoid this exposure, yeast and mold exposure. But it's also the teeth, we know, with this Nikos and all of this. Yeah, difficult world for all of us to say. But we have also genetics, epigenetics. We cannot change this extremely. Tests are not good for that. They are not standardized in most laboratories. So we need to live in a healthy environment, have a healthy, a good relationship with your husband or your wife or your family. And this gives you positive energy. So positive energy is one of the key words, and this has to do with our mind also.
Oh yeah, 100%. And when you were talking about the food, I agree with you there. You think about it, spices too. Like really good spices, putting spices back in your food because I think so many people have gotten away from using salt because they were told salt's bad or fat. Fat, you need cholesterol. Like everything, we've all been told things were so bad for us for years. You need low fat diet, no salt diet, all of that. We need salt. Like I use Celtic sea salt. Like I get a really good Celtic sea salt and I put salt in my water, in my lemon water. I just started doing that because I realized I drink so much water. Uh-oh, you're frozen, Armin. Are you still there?
Can you see me?
Yeah. Now you're back. You were frozen. I'm like,
Okay.
oh.
The Iceman. Iceman was the oldest patient for Lyme disease, the Ötzi. Iceman was frozen in the Alps, in Ötztal, Ötzi. Yeah, not far away from here, from Bavaria. So we are frozen. We are frozen, guys. Yeah.
uh, so yeah, so you need all that stuff. But it's the other thing you mentioned, like people using steroids. Lyme, steroids feed the Lyme. So it'll make you feel like you're better, but when you go off the steroids, then it's like the Lyme went on steroids. So everything like blows up because I had that happen to me back in 2014. I had a doctor put me on some kind of steroids, and another Lyme doctor's like, "You're not supposed to take steroids when you have Lyme. You can't have steroids." But also, when they put people on steroids, when they've got a problem to avoid surgery or something, it's masking that problem and it's making that problem worse where they're going to end up having surgery anyway. So why don't you use natural stuff to try and heal that? Using turmeric with black pepper, or getting the inflammation down the body, boosting the immune system, all the things that we've talked about this past hour, all the things that you can do. Because the other thing too is when you were talking about, and I'm jumping around, I'm sorry, but my brain, when people are taking supplements and you're taking a pill and your gut is unhealthy, it can't break down that pill, that capsule that you're taking when you have an unhealthy gut. You're wasting money. So tinctures, I think, are best because they get in your blood system within 5 minutes, I think it is. So it bypasses the gut. You're able to heal. Or like you do the vitamin C infusions. That's a good way to get your vitamin C. I used to do the Myers cocktail when I had my PIC line,
Mhm.
and
Yeah.
I did IV glutathione because if you can't do the glutathione by IV, then you got to take something that's going to help your body make it, like the organic sulfur. It's going to make your body make the glutathione. There's there's a reason why we have the daily 13 and the micro minerals that we need every day, not a few times a week, every day. That makes your body go. It makes your body can heal itself, but it can't do that if you're not giving it what it needs. And when you're in a deficient state from a chronic illness, you're going to have to build your body up to get yourself well. So you got to, anyway. I
Yeah,
went,
100%. During my presentation, Mayer's cocktail was the first one with the vitamin C. It was 5 gram. We are using the certified from Pesco. It's named the company. You have it in America now too. It's 7.5 gram up to 15 gram. In cancer, we are using up to higher dosages. You know, you need to be careful with the kidney a little, the kidney function, but you 100% agreement with you. So there's not any point I would disagree with you.
yeah. I did that. That was back in 2014 and 15 when I did the maybe yeah, the Myers cocktail with the glutathione. It really helped though with the Herxheimer reaction and the headaches and stuff. It really, really helped. I did it I think 3 or 4 times a week. Um,
It's pretty clear the infusion therapy, if you have the chance to do that, it's more cost effective. In the beginning of your therapy should be done in the vein because, as you mentioned, you cannot digest, you cannot resorb. And I agree 1000% again. The German herbal medicine, this is the word for the tradition. We are using tinctures, not capsules, you know. As Hildegard von Bingen, these little alcohol for stabilization in it, so that could be a knockout criteria for some alcohol intolerances, but a good herb is not a capsula; it's a tincture it's a fluid, and I like more to take the fluids than to swallow all of these capsulas, you know, and to digest them. It's a horrible situation to me to swallow all of these capsulas with gelatin around them. But the very best is to do really if you go into this Stephen Buhner's book and you Google for different herbs which you could take not as pills but as liquids. You know, these tinctures. That's an important difference in German herbal medicine traditionally.
oh yes, 100%. I love
Yeah.
I Armin, I have taken so many pills over the last 20 something. I can hardly swallow them anymore. I gag and like I just can't. I can't do it. So I tinctures all day long. I can do it. Or, like, the camu powder, I can put it in a little orange juice and I'm good. I can mix it up.
I have one tip for you. If you have a virus, so these are not tinctures. It's L-lysine. It's very often sold out in the when we are in America, we try to get it somewhere. 1,000 milligram it is, 2 to 3 times a day. L-lysine. This also a good antiviral, you know. So we use it very successfully. Additionally, in our therapies with virus patients.
Yeah, I took that for years, L-lysine. Yeah, it's
Yeah,
very, very good antiviral. Very
yeah,
good. Yep.
absolutely.
Um, Also, like I keep I use one brand of oregano oil. It's the Minutaflorum, and I'm probably saying it's wrong, strain, but I still keep it in my protocol because it targets everything. It's antimicrobial, antiviral, antibacterial, all this, like all the properties of the oregano oil, but I keep a maintenance dose of like 13 drops a day, but I got up to 65 drops a day back in 2018 to target the Bartonella. It's potent stuff,
Yeah.
but it will keep you, it'll keep you well. And it's got the antiviral properties in it, antiparasitic, all of it. So, well, Armin, why don't you tell us about any events you have coming up and where we can find you?
That's a very good question. Yes, I'm doing now more webinars and try to educate doctors and therapists around the world, in Canada and wherever we do these webinars. Yeah, the in-person conferences. There's now one in Mallorca we are, and we will go to ILETS for sure. ILETS is a huge conference in October. Yeah, it's also looking at complementary therapies now with infrared cabins or whatever. you could offer also there for patients. Yeah, our program is still filled. I came from Texas. TFIM was a very good conference there. And so there are many conferences in the world, but we do now more webinars. I think also in England, we have the Academy of Nutritional Medicine doing very successful webinars, also with Lee Cowden, with the herbs, the Cowden protocol, which is not far away from Bune. So we have a lot of actions. And I try to educate more doctors groups now. The patients, need therapists. You are a therapist. I know a little about that. I'm more diagnostic doctor, but in the end, we need therapists to do the correct diagnosis and therapies with Lyme and co-infection and other viruses and parasites. So we need education, and I'm working with the ILADF. This is the Educational Foundation from islets in America. I'm on the board, and we do now more and more training for doctors and fundamentals. We did in Lisbon for diagnostics and therapies. So knowledge is everything, but we have a big problem, a big problem. The older, as it was Stephen Buhner or Klinghardt, or these are getting older now, these guys, also me getting older. We need younger ones, we need the next generation. And the next generation is difficult to get because the doctors or therapists are educated just symptomatically, and they don't understand the holistic approach for these infections. That's very, very complicated. But we will not give up, and we have a lot of political resistance. You could imagine that in this field, but we will never give up. And in the end, the patients need to decide who helps the patient, and if it's still a placebo, so nothing in a capsule, and the patient is getting better. So this is an accepted therapy in Germany as an example. So which means, again, it could be also in your mind, the mental illness, the mental health is very, very important too.
Of course. Well, you guys have, you, Klinghardt, Cowden, Bunner, I'd say his name wrong. Bunner, how did you say it? Bunner?
Buna. I
Bunner.
think it's a Europe, German, Austrian origin. Buna. We would say Buna or Buna.
I'm saying it. Poor Dr. Bunner.
Klinghardt is also German origin. He's German, from Berlin.
I researched Dr. Cowden too. That's actually the two men when I first was putting my protocols together. Him and Bunner was who I developed my protocol with, and then Dr. Cass Ingram as well. But
Yeah.
I put all of their stuff together and made my own protocol. But they're all of you guys, you have paved the way. And you're right, we do need younger people, but there's people like me, and there's lots of advocates and activists around where we're getting louder and we're trying to help those behind us. Like, come on, you guys have got to you got to wake up, you got to understand all of this stuff, because we've been doing this for years, and you guys are going to have to take over at some point.
Make noise, guys.
Exactly.
That's important.
Exactly. So we could find you at arminlabs.com. You're on Facebook, Instagram. Are you anywhere else?
TikTok, I don't
Are you
know.
on TikTok?
If we have influencers, we need to influence, make noise. That's completely correct. Yeah, make noise together. That now May is the Lyme Awareness Month, so we make more noise than we normally do in the
Yeah,
world. Yeah.
y'all get real loud in May, so we're really bringing out the truth about everything.
Yeah.
So I will say, like, the CD57 test. I just wanted to touch briefly on that before I let you go, but I remember I found my test recently because I was going through some old papers and stuff. My number was 13 back
No,
in 2014.
it's not as it's not,
Uh-oh, you froze again, Armin.
it's not good. It sounds it's coming below 20. It's not good. Below 20 is not good.
Yeah,
Can you hear me?
I
Okay.
can now. You
So
froze.
20 is for sure chronic with pain, you were very long sick with pain. This is proven by that result.
So the CD57 test, like I had a doctor tell me back then, this was in 2013, in December 2013, when I had the testing done. The doctor told me that you were supposed to be between, like anything below 60 was an indicator for Lyme. If it was above 60, it was an indicator for AIDS or cancer. Is that true? Is that
No, the reference range is also from another laboratory in Germany. We have below 100. It's minimal chronic infection with Lyme or chlamydia or mycoplasma or other bacteria.
right?
60 and lower, it's for sure more chronic, and below 20, it's worst case chronic because natural killer cells. And if it's a virus thing, the whole CD56 are going down, and cancer. You have a problem with the CD56. The CD57 are a subpopulation of CD56 natural killer cells. So you need always to look at the whole results of these markers and not just the CD57. That's very important.
I don't think they did the CD56 because I can't
Mhm.
find it in my test
Yeah,
results.
maybe you check, and if it was chronic, it was also virus infection that time, same time.
I know I had like eight, was it eight? No.
8, it's nothing. You need to work on that.
Yeah. I think I had 12 strains of Lyme, different strains.
Oh,
Yeah, and I had Babesia, an unidentified protozoan, and then two strains of Bart. So,
mm. You had many tick bites.
yes, I did. Well, I know where I got bit, but yeah, it was. So, have we have we talked about everything we wanted to talk about, Armin?
I think it looks good. Yeah, we have find compromises and similar directions, which is important. You from former patient's perspective, me from also from a patient perspective. So we found together.
Yes. Well, I want to thank you for being here. I always appreciate you taking the time to talk with me. You have so much knowledge and information, and I think we did good today. We got loud about Lyme.
Next show will follow together for sure. Thank you very much. Thank you.
All right. Thank you, Armin.
Thank you. Have a great day. Bye bye.
Things that,
Recording this again because I'm going to put this back in. I should have done this. Go ahead, Kim. Sorry.
okay, the other thing I wanted to ask, you mentioned something called Maya's cocktail. I wanted to ask what that is or how to find it.
Myers, it's with Myer. He was in St. Hopkins University. And Professor Mayer, he was the first one who designed it with vitamin B1, B6, B12, magnesium in it, and vitamin C infusion. So that was, I think, 30 years ago or so. I don't know. Mayors, but it's if you do a vitamin C infusion, these people know, vitamin C
Okay.
infusion. Okay.
Okay, so it's a vitamin C infusion.
Exactly, but
Wonderful.
with something additionally, with vitamins, magnesium,
Yes,
panthenol,
yes,
and so it's a
yeah,
combination he designed. But in a short half an hour or so, he described that. But that was the origin, why many clinics and therapists use high dosed vitamin C. It's like
mm,
many lemons um,
yes,
in a bottle.
wonderful. And
Yeah.
the only other thing I wanted to ask about was the organic sulfur that was mentioned.
This I don't know. This is uh,
Mm.
Angela. You could explain better than I.
The
Yeah.
organic sulfur is from a company. I get it from a company in Australia, so it's in your neck of the world. It's Miracle Products, and they have a lot of great products. Actually, that's where I get my Camu powder as well. And they the organic sulfur is the third most important mineral in your body. It has so many things that it does. It helps your body make and produce glutathione naturally. It helps with your hair, skin, and nails. It helps with collagen production. It helps with your sleep. You require a half a teaspoon of sulfur. Now, this is like a scientific breakdown equivalent, but it takes a half a teaspoon of sulfur for you to sleep every night. So when you think about when you're deficient and you're experiencing chronic fatigue, and you're not able to sleep, you're experiencing insomnia, you're not having sulfur. You get sulfur from eggs, cruciferous vegetables. There's different, I think there's other foods too, but that's ones that I remember because that's the ones I eat. But I'm not
Yeah.
getting enough.
The
Go ahead, Armin.
the sulfur is also biofilm breaker. So
Yes.
to break it, so it's also additional effect. But I don't know, Angela, you need to drink a lot water without gas during this, or?
You have to drink extra water, which I drink a lot of water
Mm,
anyway. I drink my lemon Celtic salt water. And then
mhm,
because if you don't, you will, because I did this.
mhm,
One day I felt like my body, my skin was like pulling in, and I'm like, ooh, I'm not drinking enough water. So I also drink like organic watermelon juice to like extra hydrate and give me my potassium and magnesium. I do like other stuff too. I'm probably pronouncing it wrong, but Shilajit, I do that. I take pearl
mm,
powder. I do my medicinal mushrooms, but I've been incorporating things I'm in the rebuilding phase. So I'm rebuilding, but sulfur is also parasitic. It kills
mm,
parasites.
Yeah.
mm.
So it does so much.
Very.
I think it helps the gut too, Armin.
Mm.
Yeah, 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 yeah. You need it. You're sure. It's a discrepancy to our natural level here. So if
Mm.
you use it, it will be helpful. It's similar to, not similar, but it's methylene blue also. Some therapists using, detox and so, and it's very good. Yeah, if you tolerate it. But be careful. Could you do get a Herxheimer reaction, also a worsening?
If you don't
Mm,
go slow. I started out because my mom's got these little bitty teaspoons. I started out with 1/64th a teaspoon of the sulfur, and I just increased
yeah.
slowly, like every 3 or 4 days. I still experienced a little bit of like with my teeth and my gums, because you know how Lyme does with that. I had for a little bit when I would increase, I had like teeth and gum pain, because it helps rebuild your teeth and gums. The sulfur does. It also, I was thinking of something. Oh, because it detoxifies you, but it does it at a cellular level. So, and
Mm,
I can say for the first time ever, I feel like I am healing at a cellular level since putting the sulfur in. But yeah, you got to be
mhm.
careful with anything you do. You got to be smart. You
Yeah.
got to do your research.
Yeah.
So,
Well, I'd just like to say a huge thank you to both of you. And it's very, very inspiring and amazing. I'm going to be reading over my notes to try and just understand what you've said, and I'll definitely be looking at your website. So that's absolutely brilliant. And I just hope that you can get a team
Mm,
of young, inspired people who really want
mm,
to learn your methodologies, because the world really, really needs you and your team.
mm. Yeah,
So,
this is exactly the point. We need next generation people. We have now good experience. We have good concepts to help. The others don't have it. The traditional school medicine where I came from is limited still. And
mm,
patients feel that or know that more,
yeah,
and they go back to nature or natural
yeah.
ways of healing,
And
which is not a chemical world.
yeah. And that's the wonderful thing. You have an incredible tradition in
Mm.
Germany
Yeah.
of herbal medicine. And it's
Yeah.
very, very sad to hear that just in the
Mm.
last, say, 10 or 20 years, that seems to have been all but
Mm.
minimized. But let's hope it builds up again now.
Yeah, also in Germany, the last health minister Lauterbach, he tried to cancel homeopathy, and
Ah,
we have a
he,
strong community, a really good experience with it. But he said, "Oh no, you need the pharmacies, This is
well,
now the conflict of interest or lobbyism behind that." Hmm?
yeah, absolutely, because as you po correctly pointed out, where does all medicine come from? It comes from, it has ancient origins. It comes from the herbs, it comes from the minerals, and you
Yeah,
you have such a wealth of knowledge in Germany that goes back many
mm,
hundreds of years.
yeah,
Great
exactly.
wisdom.
Yeah, but the Chinese have a very long or
That's
longer
true.
The Egypt have it and the old
That's
Greek.
true.
And don't forget
Mm.
this. Hippocrates, where
Yes.
he worked. If
Yes.
you go to Epidaurus and the old
Mm.
healing, and you see how they worked with baths and to detox, they already
Mm.
knew that. But
Yes.
it's now a revival. We are going back to the roots. It's named like there was a series in America in the cinema. We go back to the roots. I think so. Yeah,
Yes.
more and more. Um,
Mm.
Thank you very much for your kind words and your
Mm.
thoughts. Thank you.
Thank you.
Thank you very much.
Mac, do you have any questions? Don't know if Mac does or not.
No, I had to figure out unmute my mic.
All right. Well, I didn't end my thing right before, so I'm just going to do a little outro now. So thank everybody for being here today. Thank Armin for being here today. Make sure you like, share, and subscribe. And I'll have Julie Millay coming up later this month. She's the author of Australian Lyme Crimes, The Global Conspiracy. So see you guys next time.